Andrea, do you want to get started?
Yeah, thanks, Emily. So thank you everybody for being here today. My name is Andrea Filio, and I so appreciate you taking the time today to be with us. The webinar today is entitled Finding the Right Mental Health Care for Your Child. We'll be talking to a variety of professionals in the field with really the intent of trying to help us all understand how we can find and support the best care for children and families in the community. So this can be a very confusing process, and it can be hard to navigate, especially when we've got a kiddo and a parent who is struggling. So we're really hoping today that we can help you understand kind of the roles of different professionals in the community and how they work with parents and children who are struggling. So we will be together for the next hour and a half here. And so until about 1 o'clock, we will be leaving about the last 10 minutes of our time today here for questions and answers. So please feel free to put any questions that you have in the chat box, and we will be sure to get to those at the end of our time together. My name is Andrea Filio. I am the founder and executive director of the Colorado Wellness Center for Girls, and I'm a licensed clinical social worker in Colorado. We are a wellness-based full-day program that works with girls between the ages of 12 and 21 that are struggling with depression, anxiety, withdrawal, self-harm, suicide ideation, and really the everyday challenges of adolescence. And our mission is to provide a highly effective program that increases girls' total well-being. Our secondary mission is for us to help families find the proper services in the community when they've got a kiddo that's struggling. And so I take a lot of inquiries during my time to point people in the right direction when the process of finding care seems overwhelming, whether that's a coach, whether it's a consultant, a transitional specialist, groups in the area, individual therapy. So we're really hoping to get the proper resources into the hands of people that need them, because sometimes going through it can feel very overwhelming and complicated. So I would like to begin today by introducing our guest panelists, which I am really thrilled to have with us here today. I know that in our world, we've got really an epidemic on our hands. And so taking the time to create this information into the community is really deeply appreciated by me, because we certainly have our hands full right now with families and kiddos, unfortunately. I'd like to begin today. I'm just going to kind of hop around here, and I'm going to begin with you, Kimberly. Thank you so much for being here today. And if you could just give a brief introduction of yourself, that would be great.
Hello, everyone. I am Kimberly Bryant. I am based out of Boulder, but work throughout the whole Boulder, Denver region and nationally. I am a psychotherapist. I specialize in attachment and family work, primarily with adolescents, young adults, and their families. I also work as a therapeutic consultant, helping families find appropriate support services in the community and nationally when their loved ones are needing higher level support than just an outpatient therapist. Thanks for having me, Andrea.
You bet. Thank you so much, Kimberly. Courtney, I'm going to go off and hand it to you. If you could do a brief introduction, that would be great.
Hi, my name is Courtney Bedell. I'm also a psychotherapist and a therapeutic consultant based out of Boulder. I practice with Kimberly. We've been working in mental health for a long time together and have grown to have this consulting practice together. My client base is a little different with therapy and consulting, but primarily, like Kimberly said, adolescents and young adults. I would say more of my practice is currently doing consulting work than therapy, but it's really helpful and important in helping navigate systems and what treatment is needed for clients.
Awesome. Thanks, Kimberly, so much. Jen, I'm going to go ahead and pass it off to you, please.
Great. Hi, everyone. I'm Jen Murphy. I'm one of the co-founders of Solutions Parenting Support, which specializes in helping parents work with their children through many facets of treatment, even preventative, as well as while they have a child in treatment, and then helping parents transition their children home from treatment. I'm a parent coach. I'm also a psychotherapist as well. And combining those two is one of the great passions that I have of being able to do both.
Wonderful. Thanks, Jen. And Hilary.
Hey, everybody. Thanks for having us, Andrea. I am the other co-owner with Jen of Solutions Parenting Support, and background is as a clinical social worker, started as a therapist for adolescents and young adults and their families, and as a wilderness therapist specifically, and clinical director, and then dove into this work with Jen, supporting parents who are struggling with their children and loved ones.
Thank you, Hilary. Thanks all four of you for being here today. And thank you, Emily, for the behind the scenes work here. I appreciate it. With that being said, kind of the behind the scenes technical piece, the webinar will be recorded and will be sent out to you afterwards. So you can go ahead and look for that. It'll also be posted on our website. If other people in your world need it, you can definitely point them in the right direction. And again, there will be a question and answer session at the end of our time today. So you can post those questions in the chat and we will make sure to spend some time at the end getting to those as well. So one of the first things I wanted to do today is to really talk about what are these job titles and what does that mean when we talk about a transitional specialist, a coach, a psychotherapist, working with parents in the coaching role, because each kid and family system is different. And sometimes it's really hard to figure out which level of care and type of care is going to be most beneficial for a child and their family. And so I'm really hoping today, by identifying these different roles and talking about what they look like in the specific work that goes behind those job titles, what that looks like. So Kimberly, I'm going to go ahead and start with you. So let's talk a little bit about when we use, sorry, I just got confused here for 1 minute. Hang on just a second. So yes, Kimberly, let's talk about your role as a therapeutic consultant. When we, sorry guys, I just totally got my notes mixed up here. So I deeply apologize. I'm just gonna step back here for a minute and gather my thoughts because I just want to make sure that we've gotten this right. Hilary, I'm going to ask you a question. Can you please kind of describe your role as a transitional specialist? So when we talk about a transitional specialist, what exactly does that mean?
Yeah, for sure. I can answer that. So we're focused on parent coaching and transition. As transition specialists, we're focusing specifically on transitions, supporting parents as they're transitioning a child who has been in some type of longer term treatment. Maybe it's wilderness therapy or residential treatment, therapeutic boarding school, and sometimes even just PHP, partial hospitalization program, and transitioning the children back home. And we focus on supporting parents with what they have control over, identifying what that is and how they want to shape the tone of the home and how they want to respond and react in new ways with the new information they have about their children coming home from treatment.
And so in terms of that role, how would you describe your primary kind of job responsibilities there? What can parents kind of expect of you as a transitional specialist when they're making that transition from that type of care back home?
So we specifically, Solutions Parenting Support specifically focuses on essentially 90 days, which can extend if needed, and of weekly support where we are helping parents to predict and prepare for situations that can arise, and to show up for their children with some critical thinking, helping them slow down, helping them put into action tools that they have learned throughout their child's treatment, taking into consideration their children's strengths and struggles to help everybody stay on track. Um, Specifically, we're doing work virtually through phone and video calls, and we're available weekly. We have at least an hour call a week, and then we're available as needed. As one of the things that Jen actually says, which I love, is we really love it when our parents are reaching out to us in between our scheduled sessions, because we're encouraging them to slow down and do things in a new way. And so when parents are reaching out to us in between, it's because they're aware they want to shift something from how they used to do it, and reaching out to help with that.
Yeah. So I think, Hilary, within that, one of the things that we talk about, and I know we'll get to this deeper in the webinar, is that when you've got a kid in any sort of treatment, and I know we're going to explore this with all of you today here, is that importance of the parent role. And I know that when a kiddo is coming out of long-term treatment or residential, that often there's a home plan that's associated with a kiddo coming out of that, and really the importance of having the parents onboarded with that home plan to make sure that all of that is kind of understood and how they can successfully implement that when their kid gets back home.
Absolutely. And I would say from a philosophical standpoint, understanding that ultimately it's while the home agreement or the home plan is an agreement between the parent and child, or parents and child, ultimately it's really an agreement between the parents, or if you're a single parent, it's an agreement with yourself that this is how you're going to show up. These are the guardrails you're going to put in place. We don't expect the kids to be as capable with follow through as the parents are. And so I think that's just an important philosophical piece about home plans.
Yeah, absolutely. It's interesting too, right? Because in a way, putting a kid back into the same system that they came from, I mean, something evidently was not going great there kind of the first time around. So switching that system up and making those changes so the parents can be aware of the shifts that need to take place, right, is just so incredibly important, because we don't want to kind of, after a kid has done so much great work, perhaps away, the system in some respects does need to change in the home environment in order to set the kid up for success.
Yeah, absolutely. And I think the pressure typically is on the identified patient, which a lot of times is that child. And so part of our work with parent coaching is helping the parents in that transition have some realistic expectations for themselves and their children, and really balance the onus and the responsibility of the shifts. Yeah,
balancing the onus and responsibilities is, I love how you said that, really incredibly important. So Jen, I'm going to switch over to you for a moment. We've talked a little bit about the role of a transitional specialist, and I know you're familiar with that as well. But I was also, if you could explain kind of the role of a parent coach, what that looks like, kind of how you set that up, what kind of the expectations are is there, so people, when they're thinking about onboarding a parent coach to help with their kiddo, what they can kind of expect from that role as well.
Right. Well, I think it's similar to what Hilary described with the transitional specialist, right? We're operating as a parent coach within that. I think for us, at Solutions, and specifically with Hilary and I, is that, we are also psychotherapists. We both have extensive careers in wilderness. So it allows us to, to walk the fence of both roles, and knowing when do we need to come in with our understanding from a clinical perspective of obstacles that parents face. And then when do we act as that parent coach, right? And so the parent coach for me, or for us, allows us to have that clinical expertise, but also allows us to be able to put it aside so that we can walk alongside a parent and support them in what they are navigating, right? As Hilary talked about, being also to be able to predict what they might navigate from all the work that we've done with families, and the recognition of what their child is bringing home with them, right? So what is it they're going to have to navigate? So I think what I want parents to think about when they're working with a parent coach is, I want them to know that we're going to ask them to dig in. Like, it's time for them, not that they haven't, but it's time to dig in and look at what their roles are and where they can make shifts. And again, understanding, what do we have control over, what we don't? What are the outcomes that we can influence, and what are the outcomes that maybe we can't? And we need to allow to be able to adjust to those outcomes. So I think from a perspective of parent coaching, I think parents should expect that there is some clinical expertise, but there's also a lot of strategic concepts that we bring to the table that are, tried and true in the sense of these work. And so let us teach you how to use them. Let's teach you how to implement them. And also let's be able to tweak them. I think that's important for parents to know that their parent coach can tweak things so it fits them. And it's not just this concept that they should be able to do. It's a concept that works, but we need to tweak it so it fits you, so you're successful in implementing it.
Right. Yeah. Makes total sense. That really kind of roll up your sleeves.
Mhm.
Again, going back to Hilary's point of the identified patient, and that these kiddos are living in a system of care, and that obviously the parents have tremendous influence over that system of care. And sometimes these parents, aren't even consciously aware of what's impacting their kiddo. And so unpacking that a little bit for them, and advocating for the kid, and trying to come from the kid's perspective of perhaps how their transactions, as we would call it in family therapy, or their verbiage, or the way that they're responding to what's happening with their kids, and helping them understand really the positive and the negative impact that that's having potentially on the whole family system.
Right. Absolutely.
And so when, and maybe Hilary or Jen, this can go to both of you, but when you are kind of setting this system up for parents, what is a kiddo that does kind of the clinical profile of a kid that would, or a clinical profile of a family that would do well with a parent coach? So when families are reaching out to you and inquiring about a parent coaching services, what are some of the circumstances that families are presenting you with that then helps make you a determination that a parent coach may be beneficial to them?
Well, I can speak to while a parent has a child in treatment, and when a parent's transitioning a child home, and then maybe Hilary can speak to the preventative work that we do. And like you're saying, like, who qualifies for that in the sense of who's going to be successful,
Right.
with using a parent coach versus another resource. And so while a family has a child in treatment, I think every parent really would benefit from having a parent coach, especially one who understands what that treatment modality looks like. Right. So when parents who have a child in wilderness and they work with us, they don't have to explain to us the interventions in wilderness. They don't have to explain to us the dynamic and the challenge of letter writing. Right. So we have that knowledge. So we're just jumping in very quickly to be able to help them walk through that process, navigate it the best they can, give them, again, ideas, strategic approaches, language, almost teaching them, like, what is the language that your child's using in wilderness, and how can we, adopt it so that it works for you, and how do we leave behind, potentially what just doesn't fit, right? So how do we tweak those things? So I think really any parent who has a child in treatment can benefit from the opportunity to really, reach in and do the work that they need to do, as well as just get the additional support, because there's a lot to process when your kid's in treatment. And then for families and parents specifically who are transitioning children out, I think, again, those parents who really can understand that the system has to change, who can also understand that, at least from our perspective, parents shoulder a significant amount of the transition. And so if they're going to shoulder the significant amount of the transition, let's shoulder it with confidence. Let's trust our gut in parenting. Let's identify what is working and what isn't working, and how do we change that, right? So it's really that idea. If they're going to shoulder the majority, why not have a partner who's going to walk alongside you from this professional standpoint to help you shoulder it and navigate it in a really successful way?
Yeah, go ahead, Hilary. Mhm.
I was gonna to the preventative piece. So when we're talking about preventing, we're talking about parents who have children, preteen, teen, young adults who are struggling behaviorally, emotionally, maybe with some school refusal, anxiety, but they're on that edge. They want to do everything they can, as every parent does, to preserve the family intact and see if they can reach out for some added layers of support before depending on removing the child from the home to get them a higher level of care. And so those parents, one, I think a requirement for doing well with a parent coach is investment with time. You know, we work with really busy full-time working parents who have typically multiple children and, you know, some single parents. And I think to be willing and able to carve out the time that it takes, and not just expect that your child is the one going to therapy, working with this person, working with that person, taking medication, but that you can dedicate time to it. And you believe in the importance of dedicating time to this support. And then also, it's really important, especially for those prevention cases where we're trying to preserve a family unit, that we really push to make sure that the child does have some type of on the ground support for us to collaborate with. And we push that on the transition side too, but to really help offer stability, we encourage that the child, and that's part of the work we do, is how do you get your child to engage in treatment and at home when they don't want to? That's often one of the obstacles.
Yeah. And speaking of that obstacle, Hilary, if you don't mind, I'm going to go there for just a minute. So when you see a kid that's struggling emotionally, psychologically, behaviorally, and there's concerns there, and you've just got a kiddo that is resistant to treatment or doesn't want to go to treatment or has all sorts of feelings about talking to somebody, can you walk me through kind of a few tips that you can give to parents? One of the things I say to parents is that you can still go through, obviously, some parent coaching, even if your kiddo is not willing to go to treatment, because maybe some shifts can take place there. But I know there's some general strategies around helping a kid consider treatment, even if they're resistant to it. So I was wondering if you could talk just a little bit about maybe 3 pointers that you can give to parents who have, you know, concerns about this kiddo, and it's been going on for a while now, and the kiddo's just not buying into working with somebody.
Yeah, I guess, so 3 tips you're asking for, and kind of ahead of the tips, I'll share that one of the observations we try to get in the work from parents is how parentable is your child, right? Do they respond ever? Do they ever show up to dinner? What are the moments where they do show up, and what are the moments when they don't show up? So we really need to assess how parentable a child is. As far as tips, I often recommend that in those moments when you wish your child was regulating themselves or practicing a skill or journaling, that's a sign for the parent to kind of look in the mirror and say, am I regulated? How do I regulate myself and bring myself back down so I'm not contributing to the escalation? What do I need to do? A journal writing? Do I need to go for a walk? Whatever it is. So just to be able to shift that a little bit and focus on what you can control. We talk a lot about finding the voice of your wise-minded parenting gut. And so wise mind is a DBT skill that's often taught in treatment. And we're not going to go into all of those details, but it's basically taking the emotional and the practical and finding the sweet spot that considers both of them. And parents, they lose faith in themselves. When they're struggling with these kids, we don't know what to do for them. And so we lose faith in ourselves. We lose trust in our parenting gut. We second guess ourselves. And so that's a lot of the work that we'll do, is identify the voice of that wise mind. So you can trust yourself again, not that it's going to solve everything, but so that you can walk away feeling like you showed up as your best self. And then there's a concrete tool that I teach that the intention is to slow things down. A lot of times, this is the first skill we're focusing on. How can you slow things down? Your child wants you to believe that everything is an urgent fire that needs to get put out right now, and they'll follow you into the bathroom to make sure it's clear. And so, as a tool for slowing things down and building in critical thinking into the family structure, I use what's called a book of asks, where the kid comes in, I need a brand new pair of jeans, whatever it might be. And it's the only thing that's going to fix my anxiety right now. You have to take me shopping. And we'll go to the book of asks, to validate that from the kid, like, let's write it down. This is something you really want, and that's important to you. And on Sunday, we're going to look at all these things that you've asked for through the week and prioritize and see what makes sense and what I need to see from you to support it. We'll come up with a list of essential questions that fit a family's values and approach for them to ask themselves. And the book of asks is used as in various situations as well. So.
Yeah, really good stuff there, Hilary. I think that we forget as adults how important it is to, and I know that we say this a lot, and I know we sound like broken records, but to take care of our own needs, and that when we get kind of immersed in the emotional dysregulation and immersed in the anxiety, in the care of our children, we're really not much benefit or help. And so one of the things in working here at the Wellness Center that I have found is that the girls actually feel bad about feeling bad. They're very cognizant and aware of the impact that their mental health struggles are having on their parents, right? And they may come off as narcissistic, and they came off as, they're selfish teenagers, but they actually feel bad about it. They feel bad when they are causing problems in the family or a burden, or they're causing their parents to be upset or unhappy. And so really sending this message from parent to child, like, I can handle this, right? Because I know how to take care of myself. I know how to do things for my own self. I'm not going to drown in this process with you. It's so important in helping these parents understand that it's not that you're disconnected or apathetic to the experience that's going on with your children. You can be in it with them, but you're not drowning in the experience with them.
I think what you're saying is so fortunate in the sense that when a child does get into therapy, that you gain that knowledge, right? And you get to share that knowledge with parents, and you get to point out what that young woman is noticing, right? And experiencing. And I think, to go back to your question about what do parents do when they can't get their kids to go to therapy because they are, for whatever reason, I think it goes back to the points that Hilary is making, to focus in that area, which is, sure, it would be ideal if every adolescent who was struggling had a therapist to influence them, and had a therapist to teach them, and had a therapist to be a sounding board for them and give them guidance. But it just doesn't, we know that. That's why you had that question, right? What do we do with kids who won't go? And so I think the recognition, from a parent coaching perspective is, again, how do we change the energy and the tone of the home? How do we change it in a way that hopefully we'll get to that place, right? And maybe we will, and maybe we won't. And what's the advantage of really putting the pressure on and using leverage to get to that place? And what is the leverage not? And what is the advantage to not to? So I think that's the discussion, right? That's the strategy. That's the, what can we control and what we can't control, and what outcomes do we really need to focus on and get to, and what outcomes do we desire, but we might just need to let go of right now because there's other things we can do. And so that, I think that would be an example of when we have those kids who don't want to go and are really, digging their heels in about it.
Yeah, absolutely, for sure.
Can I add something to answer that question also? And this is coming more from my perspective as a therapist with adolescents. I think some things that parents could try. I think it's really important for adolescents to have a choice in their therapist. Therapy doesn't help if the kid doesn't feel connected and that they can trust their therapist. So I often, when I have new inquiries, I often say, I really encourage you to set up, a 30-minute, it's usually free of charge, interview with multiple therapists so that your kid feels like they have a choice and they might feel more inclined to actually want to go. The other thing that, and I was just experiencing this yesterday, that I find really important, especially with older adolescents, is we have to listen to them. They have to like feel like they get some input in what they need and want for treatment. They're not always right, but it's important to walk through the process with them and help them feel included, not feel like they're just being told what to do and dictated. They will shut down and disengage 100% of the time if they're just being told, oh, this behavior needs to change, you have to do this. They would if they could. They can't just do that. So really engaging them in the process and helping them feel empowered, even if they're not making good choices. I think that's an important piece, that parents, when they're, like you were talking about, Hilary, when they are exhausted and they feel like they're not doing a good job as parents, it's really hard to like be able to still step away a little bit and have that perspective that you have to engage the kid.
Yeah. And so
that's where, sorry, I just thought of this too. That's where like my work yesterday was as a consultant. A 16-year-old girl who's making really dangerous choices, and she said, I feel like my parents are never listening to me. They're just making decisions and it's just about their conflict with each other. And so I was a new person in her life and interviewed her and said, what do you want? And then had a conversation with her mom. So that's where, like, as a consultant, I think we can be really helpful too. And that's usually a shorter relationship than like a therapist.
Yeah. So the parents can frame it up too and say, hey, what do you want? What would be best for you? How would this look like ideally for you? So we're putting some empowerment and control back in their laps, especially for a kiddo, I would think, that's 15, 16, 17 years old, that's wanting that sense of separation and independence from their parents. Of course, they can always go back to them, but that's very empowering. That's very liberating for a child to know that they can manage and have a voice in their treatment process. Because the reality is if we force them into a relationship that's not a good fit for whatever reason, it's not going to work out anyway. Yeah. Yeah. Great. So, Jen, I'm going to switch back to you for just a second here. Let's talk a little bit about the treatment process as a therapist. And when you are onboarding a new family who's got a kiddo, a teenager that's struggling, can you give us, what are kind of the expectations in terms of the therapeutic process, the involvement in the therapeutic process for parents? What in the therapeutic process, how do you kind of frame that up for parents who are beginning to do the therapeutic work with you?
I think you mean from like a parent coaching perspective, or like when they're in transition and they're navigating, or when they're in treatment and they're navigating their
The
child.
latter.
Okay, yeah. Well, I think a lot of it is just dependent on where they are in the treatment process, right? So if they're in wilderness, for example, or if they're in a therapeutic boarding school or residential treatment. So it really just depends on where they are in the process. So if we talk about, if they are doing preventative work with us and their child's an outpatient, right?
Yes.
So it's really dependent, because when we look at outpatient therapy, it's very different just when it comes to transparency in comparison to when a child is in treatment, somewhere like wilderness. So I think a lot of it is just helping them understand and navigate what role the therapist plays in their world, what role the therapist plays in their child's world, and what role they're going to play in the therapeutic process. So I think a lot of it is that particular breakdown. So if parents are working with us while they have a child in treatment, that their role is so different, right? They're active. There's a significant amount of transparency. There's a significant amount of vulnerability. There's a lot of, kind of behind the scenes therapy between what parents are doing and what their kids are doing. So I think a lot of it is navigating how it works, why it works, and what parents can do to reap the benefits of it in their own process. So I think that's how we probably prepare them and stay with them, right? Because there's, Hilary talks about this often. When parents have a child that go away to treatment, there's a significant amount of grief and loss that they're experiencing, but everyone's in crisis. So we often miss that. Our parents often don't acknowledge that themselves because they're just in crisis. And so I think that's a piece that we strive to always slow down so that we can talk about the grief and the loss that parents are experiencing when they're through the crisis and their child's now safe. That's where we get to breathe a little bit and talk about that really hard stuff. So I think, again, just depending on where the child is in the treatment process depends on where we're encouraging parents to go as far as their own process.
Right. Yeah, makes total sense. Hilary, did you have anything to kind of add on there?
No need. Thanks.
Okay, thank you. So let's talk a little bit about, and we can kind of jump in here, whoever kind of wants to answer this question, and then we'll go ahead and we'll go over to transfer you a little bit, Kimberly and Courtney. But how, let's talk about kind of the spectrum of what mental health care is looking like right now. So obviously we have a lot of kiddos that are struggling with anxiety and depression, right? The state of Colorado declared a state of emergency last May. We've got hospital beds that are overloaded. We've got kids that are entering the ER in crisis mode for cutting or suicide ideation. Some are being put on a 72-hour hold or perhaps longer. There's hospital beds that can't accommodate the mental health needs of kids right now. And so let's talk about kind of the spectrum here. So in my work, I see like this shift happening, like, yep, my kid was doing fine, kind of like 3rd, 4th, 5th grade. 6th, 7th grade, we see, signs of some depression, signs of some anxiety. Maybe it's moved into some more of behavioral issues. Perhaps it moves into self-harm. And then we've got contributing factors of social media and school and COVID and all of that.
Drugs
So
and alcohol.
yes, 110%, right? And so it's showing up in all of these ways. And so I think one question that perhaps it's posed in these parents' minds, and maybe even school counselors' minds and teachers' minds and anybody who's working with these kids is, number one, when do we get kiddos mental health care? And number two, what type of mental health care is most appropriate for this child? And so I think often people go to their pediatrician, right? That may be their first line of defense and say, my kiddo's struggling with A, B, C, and D. Do you have any referrals for some outpatient therapists? So let's talk a little bit about when this stuff starts to bubble up and how we as mental health professionals can help the community decide on a level of care for their child and then actually incorporate them into level of care. Because one of the barriers we find is that they'll be given a list of referrals from a hospital or from a school, and they're calling around and therapists are full, or they're not taking new clients, or they're not taking their insurance, or that therapist is not a good fit for their kids. So I'm wondering if we can talk about helping kids or helping parents or teachers find the appropriate level of care in the community. So we've got a kid that's struggling, they're showing some behavioral concerns, kind of now what? Like, what's the first step that parents can take?
I'll take this one because this is what I spend so much of my days doing, is just fielding phone calls with parents who have been guided to us to get some information of this nature. And typically the families that will stay on and work with us are families that are already in crisis and needing some higher level support. And we can explain a little bit more of that in a minute. But, oftentimes it really is an assessment and a really quick assessment of, is outpatient enough? And is that therapy? Sometimes that could be therapeutic mentorship. That could be, with a therapist also or not? Is medication necessary? Looking at, are there groups that could be more supportive in the community? Sometimes children have some undiagnosed dynamics going on. So sometimes testing might be important to help inform and understand what mental health supports are going to be appropriate. There's school support. Sometimes students are struggling so much academically that is creating some mental health difficulties. So is there more need and support in the school? So these are a lot of factors to try to sort through, Andrea, and make sense of for children. And I think that most mental health professionals are kind of working in their own silos and working in the thing that they do, and maybe don't even have awareness of a lot of the other things that are going on in the community that could be supportive to young people and to youth. And so, I in some ways, I want to say that perhaps there's even a big missing piece here, in that as a system of mental health providers for youth and young adults and families, that many people don't even know, right? So, everybody's just trying to do the best they can each day. School counselors are overridden and don't have enough time to tend to all that needs to come in their door each day. So for them to also know who are the therapists out there doing good work and what other resources are available, it's really hard for everybody to put all of those pieces together. But there's a lot out there. I think it's just how to find all of those resources. And like you're asking, like how to know what's appropriate for your individual child at a specific time in their journey can be a challenging task.
It really can be. And I think there is a missing piece there, Kimberly, of really, kind of the information that they know about their child, what they've seen all along, what they have observed, perhaps feedback that they're getting from the school. And then they have this knowledge about their child, and then they need to make a decision about it, right? And you're right, it's medication, it's therapy, perhaps it's groups, perhaps there's some undiagnosed stuff going on there. And so making this determination, especially like you said, when they're in crisis mode, can be really overwhelming. But I'm wondering, are there any suggestions about first places to start, right? Like perhaps it would be a community mental health center, or perhaps it would be going to Psychology Today and using some filter system to type in, hey, this is, what my kiddo is struggling with is, and then it helps filter out information. I don't know, but I wonder if there's a way that we can kind of help break it down for parents so it just doesn't become so overwhelming and so complicated in finding the best provider.
I think that it's going to be overwhelming. I think so. Having some expectation that that's going to be a normal experience, and then being able to take deep breaths while you walk through it. It takes years to get to the point where your children need mental health intervention, and it's going to take time to really have effective intervention, be workable for you and your family. So I think, the things you're speaking to, mental health, in the county, going to Psychology Today, we offer at our practice, we offer a couple different pieces. I do what's called referral assessments, meeting with families and really just going through a clinical interview that results in, here are the referrals, here's what really makes good sense for your child, and here are the community supports that fit that need. As therapeutic consultants, first and foremost, it's our job to assess, really understand the background and the history, and talk to teachers, providers, understand everything we can about a child, and then to provide appropriate recommendation for level of care, different layers of providers within the system that are appropriate for that child. And so but again, not to keep coming back to, this is actually something we need to all keep working at, is there's many people who wouldn't even know that we as consultants exist. And so continuing to, support our community. And this is something we do kind of on the side and relating with other providers to make sure that they understand, not just that we're here to support in this way, but to understand, do you know about these other services in the community? Do you understand that there's really exceptional parent coaches that are important for your kids that are struggling at your school, or that there's mentors for your clients that aren't getting enough out of outpatient therapy? So some of it is that we all have a responsibility professionally to keep educating each other too.
Yeah.
I was going to add something and I'm kind of forgetting. Oh, I was going to say, as Kimberly mentioned, a lot of our consulting work starts with families in crisis where there's already a known need for a higher level of care. But one of the things that we saw happen a lot during the pandemic was people wanting to keep their kids at home and not move them around or not put them in residential treatment or wilderness. And what has come of that is us really seeing the need for kind of what we call case management in the community. So like we're both clinicians, we do a lot of assessment on the front end. And then in an effort to try and keep the kid in the community and get community-based services in place, we then stay on board and kind of facilitate that treatment team. And we found that a lot of success in that. So a treatment team might be the psychiatrist, the kid's individual therapist, the parent coaches, maybe someone from the school or a mentor or something like that. And then us as the consultant, we make sure that everybody's communicating about any changes that happen and that the parent coach goals are being communicated to the individual therapist goals. And while it's hard to really like promote that service because it's a lot of work and we've been very overwhelmed lately with work, but I would like to see more of that happening at a community level to keep kids at home and network and get providers connected to support kids staying at home and families healing at home.
Yeah, absolutely. Absolutely. I think that if we can find an interim in there, maybe residential and wilderness is appropriate and maybe it's not, but if we can find something that's a smaller step along the way, I think that can be really, really great to keep that family intact and at home, because it's a big decision to send a kid away, and definitely appropriate at times and 100% in the best interest, but at other times, maybe we can look at something different too. So hear what you say there for sure. I think that, this idea of kind of everybody working together and getting families on board and them being open to change and rolling up their sleeves and getting into their work with their kids. Courtney or Kimberly, I'm wondering if you can speak to, working with families that maybe are not on board, or participation in the process looks a little bit different, or that they have very different ideas about the best interest of their child, or there's family dynamics that are going on there that really have nothing to do with kiddos' care, but more about the parents and the family system themselves. So I guess my question to you is, working with challenging families and what you can say about that and what you do about that when that presents itself to you.
Kimberly, I think you should answer first and then I'll follow up.
Sure. There were a lot of questions in there, Andrea, so I'm going to try to hold. As trauma-informed and relationship-focused therapists, I think that speaks for itself in our orientation, and that first and foremost, we have to be able to develop relationship with the parents that are seeking support. And so, regardless of complexity, when a parent is in crisis, they need to know that we're coming in to walk alongside them, advocate for them, hold their hand. When parents are not on the same page, we have a responsibility to educate both parents and help both parents get caught up to speed with what is truly happening. And so our skill in being able to communicate effectively and to build rapport and safety with parents as we are jumping right in to the deep end with them is imperative. That's really an essential piece of our work. I think, one of the things that is real is that I find that our responsibility and our job is to identify what is clinically indicated for a child, what do they need, and based on what we have within our culture and our mental health system, what's appropriate for their care. And sometimes parents are not going to be on board with that. They're not going to agree, or they're not going to feel they don't have the resources to do those things, because, there's private mental health system and there's public insurance-based mental health system, and it's very complex, and they really are different worlds. And so, our job is not to tell families what they should or shouldn't do. Our job is to make sure families understand all the options and the lay of the land, and then our job is to support what they decide is in the best interest of their family. So I think that's a really important piece, is that as providers, we can have all the information and we can have all the ideas about what a child needs, but there's a need to trust the soul and the system of a family and the wisdom that lives in that, and to follow that as the lead. And we're only as good as the community within which we work, and the network that we create and trust into, so that we can make sure families are connected in the right ways. So I know I'm trying to hit all your questions here, but I think effectively it's about some form of trusting the wisdom of a family and the wisdom of parents, even when they're in crisis and even when they might be in conflict and struggling, and being able to pull that out so that we can guide them to their best path along the way.
Yeah, that makes a lot of sense to me, Kimberly, because we don't know these parents and these families as well as they know themselves. We can't make assumptions about their belief system or their values or their history. And so it is sometimes, in working with parents, I have found professionally too, that if we can just scrape away a couple of layers on the top, and maybe scrape away some of the fear or of their own stuff that they've brought along the way, then underneath it all, there is information there. There is guidance there. They do have a North Star on what they believe is in the best interest of not only their kid and their family, but the emotional stuff, I think, gets clouded along the way. And so part of our jobs is to help them find that within themselves. So I really like that a lot, because they do know and have experienced their kid obviously deeply along the way, and probably have a lot of information until we start asking those questions of the parents, then we really don't know.
The only thing I was thinking to add is when there are two parents that aren't in alignment, want different things, and we're talking about maybe higher level of care, I often think it's really important to really defer to the kid's therapist and what their clinical recommendations are, knowing that hopefully there is a clinician in place, knowing that clinician has a protected relationship with the child and can truly advocate for what's in their best interest. And then kind of our job as consultants and therapists and parent coaches is to help parents navigate internalizing that and accepting that. Like, you may disagree, but this is what we all really truly believe is in the best interest of your child, and try and help them see that and understand that.
Yeah, absolutely. Let's talk about a little bit about when you've got a kiddo in treatment outpatient. So you've got not wilderness, not residential. Let's talk about that. You've got an adolescent in therapy with an individual therapist. And let's talk a little bit about what parents can kind of expect in that process. What, in your opinion, has been most helpful for parents to know when they have a kid in outpatient treatment? I think that working here, parents have really been shocked at the amount of involvement that we expect for them to have in their kids' treatment. It's not just you can kind of drop your kid at the door here and we'll work with your daughter all day long and then kind of hand her back to you and poof, she's fine and feeling much better. That these kids are so integrated, appropriately so, in the family system because they're children. What are some pieces of information to set these parents up for success when their kids are in outpatient treatment that you have found to be most helpful? Obviously, there's a lot of looking at their own stuff, a lot of conscious parenting that goes along with that. But what are some of, when you've seen success in family therapy, when a kid is in treatment, why has that been successful? What are the parents doing alongside with their child that has been the most helpful?
Are you asking about when a child's in their own individual outpatient or when the family is in outpatient, or both?
Both.
Mm-hmm. I think that, and this might not be quite answering the one side of the question, but I think it's important for parents to understand that within the outpatient provider community for teenagers, there's differing attitudes and orientations to what gets shared with parents. In the state of Colorado, if a child is 12 years old or above, they have to sign release for a therapist to be able to speak with their parent. And so some therapists, myself being one of them, all of my adolescents sign release for me to talk to their parents. That's an open book. It doesn't mean I'm going to just go talk about whatever with parents that gets brought up, but that I need to have that as a flexible and open conversation. And some adolescent therapists won't choose not to do that and really don't want any contact with parents. So I think that that's just a piece to vet and understand if you're going to be working with an adolescent therapist. I think what's most effective, though, is that if you can have a relationship where there can be some form of update and information sharing, and especially if there's family therapy happening, which is always ideal to have parent coaching and family work occurring if your child's in their own individual therapy, that those therapists have releases an ability to collaborate and work together on behalf of the family. I also think that there's some different orientations to family work where some family therapists really just hold space, and some family therapists are much more directive and guiding a process. And I think that the latter is often more effective because it really gives parents some guidelines and some guideposts to what it is they're trying to do. And when parents are willing to take feedback and try new things, I think that's worth its weight in gold, right? Is that we just are willing to step outside of old patterns and try new things to see what we can shift. Those are a few thoughts.
Yeah.
Right. I think you did exactly what you said. Like, I think you said it perfectly. And I think from a parenting perspective, I want parents to know everything you just said. Like, there is, on the spectrum, this is what you can have with an adolescent therapist and a family therapist. And so as a parent, knowing what do I need and what can I honor as well, right? So I often teach parents that when you think about transparency, what is it about transparency that you need in a therapist? And can that therapist provide it for you? And is the amount of transparency you're asking for appropriate, right? Like, so really breaking that down to understand whose need are we meeting here and what is the necessity of the transparency that you need. And then the other piece would be how do we honor the process of individual therapy for adolescents? How do we honor the process of confidentiality while we're still ensuring that our adolescents are in a safe place and the work that's being done is moving them forward, right? So I think it's a balancing act, but as Kimberly said, a lot of it's just dependent on how the outpatient therapist operates. So knowing what you want first as a parent is probably a good idea before you're introducing, the therapist for your child to choose from.
Absolutely. Yeah, that makes a lot of sense to me. Hilary, I know that as a parent coach, and and correct me if I got this wrong, but that you only work with the parents, right, in the parent coaching sessions. Can you tell me why you find that to be effective, and kind of what is the framework for the parent coaching sessions? Like how do you describe what parent coaching looks like to a parent when you are taking on a new family?
Yeah, so thinking about your first question about why we chose in our coaching business to just work with parents, I'm actually thinking about the previous question also a little bit in one of the not great ways for parents to show up to family therapy is to show up thinking that you're just going to get an ally in the mediator to get the kid on your side, or to get the kid to see your perspective, or that it's a place to go so you can vent about the kid's behaviors and have the mediator, family therapist, tell the kid what to do and the kid's going to listen, right? So that is essentially one of the reasons why we chose this model of just working with parents, because oftentimes the family dynamic, the kid kind of becomes the scapegoat, right? And when in models where coaches are also working with the kids, there's pros and cons. We chose this because we really wanted to help continue to shift the parents' focus on what they have control over. Already our conversations will leak into, how do I get them out of bed to go to school in the morning? How do I get them to change their behavior? And we'll shift to what can you change that will hopefully have some effect. But I'm not here to change your child's behavior. I'm here to help you change yours and to take control of the tone of the home and really just make sure we can do everything to have that be the focus. The framework for parent coaching, I think with everything, we start with assessment. When you show up in the work with us, we want to gather information. We want to learn what you see as your strengths and struggles as a person, as a parent, gather information about the situation that you're in and that you've been in. And so there's a assessment info gathering, and oftentimes, similar to what Kimberly said, parents are coming to us, there's some crisis happening, they need concrete strategies fast. And this is part of what separates a parent coach from being a therapist. We are focused on concrete strategies, brainstorming together to better manage specific situations. And I think also we're highlighting a handful of processes and habits. We're really in the business of helping parents form new habits. And maybe it's just a handful of habits and then learning how they fit into different situations, right? Like the Book of Asks is a process of slowing things down and building in a habit of critical thinking into the day-to-day. So then we'll focus on where else does that critical thinking habit fit as a strategy for changing the tone of a situation or predicting and preparing differently for a situation. So it's a little bit of predicting and preparing work, and it's a little bit of in the moment situation management. And I think that over time, the goal is let's identify a handful of habits and the situations that you want to be able to better manage. Part of the assessment process is also identifying the top risk areas, let's say, because there's just not enough time in the day to figure out a strategy and the great ideal approach for every situation you're going to be faced with. None of us have the emotional currency to put that amount of time in. And so if we can really focus on the most risky areas, mid to high risk areas around which you want to set up guardrails, and then we identify what are the guardrails that you can truly be consistent with based on your lifestyle, your capabilities, the team that you have as a parent, or if you're on your own. I would also say, and I'll stop here, is in split families, we were talking about working in different households, rather than trying to get each household on the same page with everything. I mean, if they could be, they'd still be married, right? And so again, we focus on these top few high risk areas that we want to get as consistent with as we can, and then allow the individual households to be unique. They have unique relationships with their kids, they have unique approaches, and so we can offer suggestions for different models in each household.
Yeah, that's really helpful, Hilary, because we bump into that here of like this expectation that we're going to get the parents to think alike and behave alike, and that both houses going to look exactly alike. And that feels like we're banging our head against the wall. And the reality is that it is going to be different. And I know that's harder on the kid, but such an important thing. And you brought up this high risk behaviors, and I'm wondering if you're seeing this a lot, because I know that we are. The high risk behaviors that we're seeing are managing a kiddo who's self-harming, and managing a kid who is telling their parents that they're, feeling suicidal. And so the high risk behaviors that we're coaching parents on how to manage those crisis situations is something that we're bumping into a lot. And I'm wondering if that sounds familiar to you too.
Oh, for sure. And honestly, I think more frequently, some of the high risk behaviors is isolating on technology in your room and not being able, like making your world, especially through COVID, making your world smaller and smaller and smaller, and not interacting, not having balance. I think that's a high risk situation that we're seeing even more frequently than some of the suicidality.
Yeah.
But yes, it is out there.
Yeah. Courtney or Kimberly or Jen, did you have anything kind of that you wanted to tail into that about some of these high risk behaviors and helping guide either therapeutically, coaching, or through the transitional process when you're bumping into all of these behaviors that we're seeing with adolescents right now?
I think the only thing that really comes to mind for me is the access and the potency of marijuana and drugs and alcohol that kids have access to. It's different from when we were kids. It's different from 5 years ago. And it's really dangerous. That I'm finding more and more like clients and parents and friends who it escalates so quickly that there's a greater need for intervention, and parents aren't even aware that it's going on. That I'm finding a lot of like pressure, like it's a pressure cooker in that right now.
Yeah.
And the isolation that Hilary was talking about. COVID was so hard on teenagers, not having that, adolescence is a time where you developmentally individuate from your parents. Like that's your job as an adolescent, is to start to be your own person. And these kids were all like closed off, except for they had these screens that are scrambling their brains. That was the only way they could connect with other kids. It was really, really detrimental to them.
I think it's important to name that if you are worried that there might be a need for some kind of intervention or support for your child, to not overlook that, to really, maybe that starts with a check-in with the school team, but, don't let that kind of pass by for too long. If it's something that continues to arise, I think there's a lot of parents are like, oh, it's just teenagers, they'll just be fine. And then things really can escalate quickly. And so if your gut is telling you there's something that needs attention, listen to that. I think that's really important.
Absolutely. And finding that time and making that space with your kid is really huge. And I know we hear this all the time. It's not just sitting down with your kid and this one-on-one session and saying, what's going on with you? It's really organically connecting with them. Like when you're out and about or taking a walk with them or taking a drive with them, that's when kids open up. That's when kids, I think, feel a little less pressure to express themselves and what's going on with themselves, when it feels a little bit more organic. One of the things, and I don't want to throw parents under the bus because I know we're all trying to do the best we can right now, but we have expectations for our kids of getting off social media and getting off our phones. And what I'm hearing from the girls here a lot is I can't connect with my parents because they're on their phones and they're preoccupied and they're busy and I can't get their attention. And I know parents are frustrated that their kids are isolating and on their phones in their room, but I think as parents, we need to be really cognizant that that's kind of what we're doing ourselves as well and what we're modeling for our kids. And it takes away from that connection for them. So if we're going to expect them to put their stuff down, then we need to put our stuff down too and carve out that time for our kids, because they're going to say they don't want it and, you know, get out of my room and I don't want to talk about it. But the fact of the matter is that I hear very, very differently directly from the kids themselves, that it's actually exactly what they're craving. And that even though the words are coming out of their mouth that, no, I don't want this, that they actually are. And it's actually what they're needing. So us parents have to read between the lines a lot of the times and differentiate between what our kids are saying to us and what they actually need. And so I think individuation and separation is, of course, developmentally appropriate and absolutely. And at the same time, they are really looking for that deep connection. And I think that a lot of things have gotten in the way of that connection. And there's a lot of things that parents can do and school counselors and people in their community can do. I mean, we're all wired for connection. I'm reading a really great book right now on how we can organically just work with our kids in terms of building relationships with them and building those communication patterns and keeping an open relationship with our kids in spite of how they may behave. Because when they're cutting and when they're suicidal, you know, these are coping strategies, right? Where they're coping strategies and a signal to us that something's awry, that something's not right. And of course, we get really fearful around all of these self-harm tactics because it's scary, and we get into panic mode as parents a lot. But if we can read it as a signal and really take a step back and say, what is my kid really trying to tell me? What is this behavior really trying to demonstrate? And ask them really good questions about that. I think that that's a really good starting point for developing those relationships. I just saw really quickly in the chat, and I happen to have the book right here with me. It's called Wired to Connect: The Surprising Link Between Brain Science and Strong, Healthy Relationships. The author is Amy Banks, MD, and it really gives some really great practical things that we can do just as human beings in helping to connect to our kids and how vitally important it is. And COVID did a terrible job on that disconnection level, but we can do a lot of repair work around it for sure. I also want to mention that on the Wellness Center website, we now have a Google site. You can go straight to our resource page and it has all of the providers in the mental health community that I have found and that I have vetted out. So that's psychotherapists, coaches, transitional specialists, groups, psychiatrists, people that specialize in neurodiversity and on the autism spectrum, other providers that are a little more intensive, like the Colorado Wellness Center for Girls that provides full day programs or after school programs. They are all on that Google site. So Psychology Today is a great one. Going to your pediatrician's a great one. Getting referrals from the schools is a great one. But if you need that site as well, it's always there. And you can just click on directly all of those providers and it will take you directly to their website. If you have any questions about those providers or need more help in the navigation process, you can always call me and I'm happy to help you point you in the right direction to get your kid, son or daughter, the help that they need. So right now, yeah, go ahead.
I'm going to put the name of 3 books in the chat also that we talked about preparing for. The Parallel Process is a really good book for parents when their kids are going into treatment or need a higher level of care. It really touches on that, like grief and the struggle of like a kid going to treatment. The Journey of the Heroic Parent is a great book by Brad Reedy. And the other one I put in there is, which I don't have in front of me, is Yes, Your Teen is Crazy. I think it's not all gold, but I think it helps parents understand kind of what your adolescent is going through, how they're wired, helps parents just maybe tune in with them a little bit more.
Awesome. Thank you, Courtney.
Yep.
Another one that came to my mind, I don't have it in front of me either, is the conscious parent. That is a really good one, and helping parents take a step back and yes, brainstorm too. Yeah. So the conscious parent and brainstorm are also really good ones. When we have a kid that's struggling and we're feeling that sense of hopelessness and helplessness, one of the first things we can do is really try and improve upon our parenting skills. And really the question that I always pose to parents is, how can I better understand what my kid is going through? And how can I show up in a way that's beneficial? One of the biggest skills that we can do is, and I know this sounds really simple, but is really improving our listening skills. One of the biggest complaints I get, and I think, Courtney, you may have hit on this, is that kiddos are really feeling like their parents are not listening to what they're saying. And they jump in and they guide, or they advise, or they panic, or they get scared, or they jump in too prematurely to the conversation. So if we can develop and sharpen those listening skills, use some empathy and validation when our kids are struggling, I think it can go a surprisingly long way, because I think parents sometimes think that they're listening, but the perspective of the child is that they're actually not doing a very good job of that. And so that comes with practice. And so one of the things that I coach our parents to do here is, I'm going to let your child talk for 5 minutes, and you don't need to say anything, right? You don't need to advise, you don't need to guide, you don't need to jump in. I'm just going to simply give your child 5 minutes to talk. And whether the child fills up that 5 minutes or not, but it gives kids permission to talk. It gives them the ability to do that. And so that's one of the very simple things that parents can do right off the bat in terms of opening up those communication patterns with their child. Because again, believe it or not, they really do want a close relationship with us as adults. As much as they may fight it, they're really in need of that, and it can go an awfully long way. So it is about 12:58. So we've got about 10 or 12 minutes here for questions and answers. So now would be a great time to kind of go through that chat and go through those questions and see what we got there. So does anybody want to put in any questions right now that they have for any of our guest panelists today?
While folks are thinking about questions, I wanted to just note, through the pandemic and everybody being home together through this individuation process, one of the pieces that we witnessed is that parents were being observed more often, and they were working from home and parenting together, both parents working from home, and they were on stage in a way that they had not been. And I often found an opportunity to ask parents if they were role modeling that being an adult is awesome, because of the amount of stress and anxiety and fear of growing up that a lot of our kids are experiencing now that they didn't 20 years ago. So just another question to ask yourself, what about being an adult is awesome, and how am I showing that?
Thanks, Hilary. That's really awesome and beautiful. I think it's important to name that, across my caseload of kids, this is a huge issue. A lot of fear about transitioning into young adulthood and not wanting to. And it looks really scary and complicated.
Hilary and Kimberly, I'm really glad that you brought that up, because I'm going to do 2 prongs here. Number one is, they have access to the world around them and a lot of fearful, crazy, uncertain things that have happened. And also sending the message to our kids that, yeah, there are a lot of things that are complicated in the world around us right now, but also on the flip side of introducing them to positive things as well, and things that are going well, and how their home is safe, and how we can consistently show up for them. We have such a heavy focus on what's going wrong in the world around them, and no wonder they're becoming fearful about stepping into it. but we really need to be cognizant of presenting them with things that are also going well, because there's plenty of things, if we scrape away the surface, that are there, that we can show them that are actually beneficial, and that things that are, being pointed in the right direction as well. The other piece is that when I have parents come in, either with a phone inquiry or they come to a site visit at the wellness center, the first thing they tell me is kind of what's wrong with their kid and what the diagnosis is and the trouble that they're having and the struggles and what they're doing bad and what they're scared of and what the behavior is. And sometimes I'll back that up and say, you know what, before we get into all of that, tell me what's great about your kid. What are their strengths? What do they like doing? What are their hobbies? What are their interests? So we're going past the diagnosis, and we're actually getting to know the person themselves, not only the kid themselves, but the parent themselves, because sometimes we get so lost in what's going wrong and what the struggle is that we lose sight that we've got actually a human being underneath there. And so the first time that I asked the question to my parents, hey, before we get into kind of what brought you here, tell me from a very strength-based lens, what's great about your kid? What do they like doing? What are they good at? What are their interests? What sparks their fire? And so all of a sudden they remember that there's a child underneath there. And for the kid, it's a completely different question that I'm asking of them. And so sometimes I think these kids get so lost in a diagnosis and they become so flooded in what's going wrong that they actually lose sight of the person themselves. And so I think not only can we highlight that, yeah, the world can be scary, but there are also some really good things that are going on there. And there's also some really good things inside this kid themselves that we can pull on. I think is a really good perspective to have, because they forget about it when they get lost in the struggle. So the question here is, who or where would you recommend for a 14-year-old girl who is doing okay, but struggling the last few years? She doesn't need intensive therapy, but needs better output support, and we haven't found that place. She has significant anxiety, ADD, and learning differences / developmental delays, and is just dealing with normal teen girl stuff, amplified by the above issues and, of course, the pandemic. We have tried a few therapists that she says she likes and tells them what they want to hear, but hasn't made progress. We are doing our best to support and work on ourselves and our listening / parenting skills. Maybe family therapy and parent consultant would be better than individual counseling for her. So I'm not sure who wants to take that, but
I think parent coaching would definitely help, but I'm biased.
yeah.
I think
so
the piece
what
I would
about-
add about families who are considering family therapy and in the situation that was just described is just having intention behind what you're going to family therapy for. And I think this is similar to what has been talked about. Like, are we going to family therapy to make our child different or make our child better even? Or are we going to family therapy to enhance the family system, to enhance relationships, to talk about how do we strengthen our relationships to give you the support you need as you navigate this world and as you navigate what you're going through. So I love when parents want to do family therapy and they're making the investment, but I want parents to be more intentional about what is their reason to go, and to make sure that that reason is inclusive with the whole system doing the work, not just we're going to go because our child may need it, so we're going to go along with them.
Gotcha. And so when we're talking about here, significant anxiety, ADD, learning differences, developmental delays, and it's just dealing with normal teen girl stuff amplified. So this, I don't know, but this speaks to me as like social support, a place where she, right, where she can link, where she can connect, right, where she can find other kids to go back and forth with, to socialize with, to experience healthy teen interaction. And so Courtney, does that strike you as such?
Yeah, that's what I was thinking too. That's what I pulled out of that, is a way for this girl to find some peers that she can connect with. I don't know that it's appropriate, but the couple of places that come to, I don't know where, Julia, where you live, but Cherry Creek Psychotherapy is a DBT group for teenagers. And then I don't know if she'd be appropriate, but a place like Equinox Wellness, Counseling and Wellness, they do some more like experiential outdoor activities. They'll do like their mental health supported, but we'll take kids rock climbing or hiking or maybe something like that. Those are just a couple of thoughts for you to look into.
Yeah. Yeah.
I have no idea. It's really hard for us to make recommendations without really knowing your daughter, but those are just a couple places that come to mind that might help you go down the right path.
Yeah, and Hilary put in there, executive functioning coach can offer tools as well. In terms of executive functioning and neurodiversity, this Guiding Bright Minds website was put together by a mom who has a son who's struggling with some neurodiversity. So she's taken it upon herself to put in all of the resources in Guiding Bright Mind, which are treatment professionals, groups, social activities, clubs, events, assessment professionals that specifically deal with neurodiversity. So you can actually scroll at whatever kind of service that you think would be most appropriate for your child, and then they can pull you up with resources. Yes, guidingbrightminds.com is a really good one. This speaks to me of really building on that teenagers need to connect with other kids, right? They need that neuro influence. They need to be, this is where self-confidence, this is where self-worth, it comes in relationships of having people in their tribe, of having people that they can go out with, having people that they can interact with and socialize. This is what breeds such an important part of appropriate development, and by default breeds self-confidence and self-worth. And so another side effect, negative side effect of the pandemic is that it isolated and it pulled kids apart. And so the number one priority I would recommend there is to get that neurological connection with other kids, because it just can do wonders in terms of filling that social bucket and filling that developmentally appropriate stage of life where kids want to have friends and they want to go out and they want to have people. And it just makes perfect sense to me in terms of trying to establish those connections as much as possible. So, okay, so we've got about 1 minute here. I'm not seeing any other questions in the chat. So again, this will be recorded. And if you need access to any of the resources that we talked about today, feel free to reach out. Happy to pass those forward. Kimberly, Courtney, Hilary, and Jen, I can't thank you enough for your time today. You are so great at what you do. You really have brought such value and direction and solidification of these roles and trying to get families the best and most effective care possible. So thank you for all your hard work. Thank you for all of your time today. And thank you everybody who took the time to be here today. And I hope you all have a wonderful afternoon. Yes.
Thank you.
Okay.
For having
Take care,
us.
everybody. Bye-bye.
Bye.
Bye.